Hello and welcome to another episode of COVID DF Dialogue. Today we are going to talk to Dr. Amirullah Khan, who calls himself a teacher. Apparently, these days online he is teaching the whole world. He teaches at ISB, he teaches at Ashoka, and he is also known for being a great economist. Although also, always has this, theory of questioning the government, which doesn't like. But let's talk to him and find out what COVID has done to the country and what are the mitigation that we can, follow. Uh, Amir, welcome to DF Dialogue. And we straight away, we were discussing about few weeks back about the, very harsh impact of COVID, but now we are in 3-4 weeks inside and even more after the lockdown. What is your, first reaction to the way COVID has impacted India and the lockdown has impacted India?
Yeah, thanks, Sama. This is a great idea that we are having these DEF dialogues. Um, to directly answer your question, I think the first point I would like to make is that the impact of COVID on the healthcare sector has been far lesser than what most of us thought would be the case, which is great news. Because when we looked at the impact of this epidemic, then the numbers suggested large scale harakiri. It suggested that we would have 1 million people positive, 100,000 dead by now, but nothing like that has happened. We are less than a hundredth of where most projections went. It is still a moot point as to why that happened and how India escaped the fury of this virus. And we will, over the course of time, find out what the advantages were for India. However, on the other hand, India's major problem is the economic impact, and that is unlike what we see across the world. You see, one very interesting thing about this virus is that it seems to be unlike most diseases that the world sees, in the sense that it till now it has been restricted to the north and the richer parts of the world. So if you see the distribution is too unique to be ignored. One still is still early days, but what I mean is that if you look at how the disease started, it starts in China, the second richest country in the world, goes to Italy, Spain, stops for a while in Iran, South Korea, and settles down in the US and UK. It does not really impact the poor countries of the world. You don't hear of too many people testing positive or dying in South Asia, in Sub-Saharan Africa, in Latin America. Of course, there is Australia and New Zealand, which are rich countries, which also have escaped this disease. So there is something about a geographical trend to this disease, and a trend that it attacks the richer countries first. Even in India, if you see, uh, if you look at the states, it is Maharashtra, Tamil Nadu, Kerala, Karnataka, Telangana, and now Gujarat. You don't hear of large scale problems in Chhattisgarh and Jharkhand and Manipur and Meghalaya, or
But
even
that may be also because we are not testing, we don't know.
so now why this has happened? There can be a number of reasons, right? There is no robust reason right now. We can speculate. Is it because people don't travel from the poorer states to China? Is it because the international exposure is less for these countries? Is it because it's the south? Is it because of the accentuated temperature, BCG vaccine? You have a plethora of causalities that are being thrown about, and none of which are yet tested. It could be any of those, it could be none of those, it could be some new thing altogether. Anyway, so the point is that, to your question, that the impact of COVID has not been as damaging to the healthcare sector as we thought it would be. However, the economy is in tatters. The economy is in really bad shape. And I must clarify two issues immediately. One is that that to think that the economy is in bad shape post-COVID might not be the right thing. Even in December, the Indian economy was tethering at the brink. Uh, I often remind people about the results of the last year's quarter, which said that India's growth rate was the lowest in about 18 years. India's unemployment was at its highest ever in post-independence history. Exports had been tanking for nearly 19 months uh, continuously, and the exchange rate was at its worst. So even before COVID, the economy was in a bad shape. GST returns were going down every month, and therefore the government had absolutely zero fiscal space when it got hit by this virus. So therefore, one myth that one must clear is that the economy got into a bad shape post COVID. No, economy was in a very bad shape pre COVID. The second point, and often I hear people say this, that the government did the right thing by imposing the lockdown at the right time. That could not be, that is certainly not as true as it is made out to be, because it was clear that by early March that we were headed for a problem. Most other countries, including African countries, had started imposing lockdown early in March. We waited till the 24th of March. I think we wasted 2 good weeks. And those 2 good weeks, and the reason I point that out and underline those 2 weeks is because it is those 2 weeks that would have allowed us to prepare for everything that we did not. Now, let me tell you what I mean by that. That's the substantial part of what I want to say. In India, because of the unfortunate usage of the word curfew by the Prime Minister himself, a humanitarian problem became a law and order problem. A problem that should have been tackled by the health administration, by doctors, by nurses, now became a problem that is being tackled by the police. Now, when the police hears that it has a problem to tackle, when the police is told that there is a curfew on, then the police uses the lathi. And that is what we saw. In a situation where we need to give sympathy, where we need to give help, where we need to provide assistance, we are beating people up on the streets. That is what happened, that the lockdown became seen as a curfew. The meaning of the word lockdown, as you see across the world, is that there is no restriction on people moving out of their houses. If people are moving, if they are walking around, if they are cycling, if they are driving, if they are going to the grocery store, that if they are going to parks, that is not what is discouraged. What is discouraged is any crowd. And that is what we should have done. We should have used those 2 weeks to prepare people, to ensure that as many of them reach home as possible. Several people got stranded. Schools had to rush and send their students out. Hostels had to be vacated. And the migrant labor story is writ large all over the world. The biggest problem was that so many trucks, the estimate is about 30,000 trucks with food and perishable material is lying on the highways. So let me tell you about the economy, Osama, and that is one major issue that we should have taken care of, which was that we should have, on the 1st of March itself, marshaled all our technology sources. You see, what we forget is that we are a nation which is on one hand very poor, but we have very many technological resources. Now, we could have deployed them on the 1st of March. What do I mean by that? What I mean by that is that look at us today. If I want to order something online, I have nobody to order from. If I want to go out and shop at the grocery, I have to go and stand in a queue. If we had ensured that e-commerce was was empowered right in the beginning with apps, with simple phone call facilities, then we could have done contactless shopping right from the day one. We would have enabled. Why are our hotels and our fast food restaurants shut down? Why are they not doing contactless delivery across the city? Thankfully, this is an urban problem even now. Even now, our cities are not affected. And all our urban centers are pretty much digitally empowered. We should have prepared the digital platform right in the beginning to allow for some delivery, to allow for some shopping, to allow for some usage of apps and so on, to ensure distribution of food grains and distribution of food. Right in the beginning, one of the first suggestions made to the government was that, look, give three things to everybody. Give them money because they need some money to buy groceries. Give them food because they will be without food for a long time. Third, give them bandwidth. See, at this point in time, the only contact I have with, with the poor in my neighborhood, in the city, is the telephone, is WhatsApp, is Zoom. And if we had allowed everyone, if we had given, it was a very simple matter of giving everybody 3 months of prepaid bandwidth. Everybody with a smartphone. As I told you, this is an urban problem.
Or even talk time, because many people
or even talk time. That was one of the first things to do. That would have allowed us to set up networks, which we are now doing. Now we are setting up some apps that allow us to trace people who want free rations. We want to reach them. The government is using them. But it is rather too late. We should have done this right in the beginning. So yeah, go ahead.
So what I'm saying is that, I was talking to Mr. Arun Meher a couple of days back, and he was saying that, human needed economy, to help themselves. But then gradually economy started using humans to create GDPs, to create more usage, more consumerism, more affluence, more, consumption, and so on and so forth. So do you see that because the COVID is contact? I mean, you are absolutely right, and this is a great sentence that you use, that it doesn't COVID doesn't allow you to have contact, and technology allows you to live without contact. So this is a great enabler at the time of maintenance of distance, and it would have even helped the economy to continue. But where does the economy go from here? Because the whole world lived with an economy which allowed movement, travel, trading, displacement, migration. If you see the formula of economy and the calculation of economy, the way it grew is movement, movement. But now movement is not there, and God knows till when we will not have movements. So in this scenario, what do we do? I mean, do you see that this whole slump in larger economy like Europe and Americas are going down so badly, it will ultimately affect India? Or rather, some people are saying India always lived on a low economy. It may survive even better because we know how to live at low income, low money, low intake, low consumption, low expenses.
Well, let me answer this in some detail. You see, you are absolutely right that the driver of the global economy, at least over the last 50 years, 40 years, has been the migration of labor, have been the movement of labor. Prior to that, it wasn't so. We were a very inward-looking world in the 20th century. Much of the 20th century, we were a very high tariff, high restriction, inward-looking world, and that is where the world really developed. It was, from the 1940s to the 1980s, it was still a Cold War era. It was still huge suspicion of other nationalities, and so it was after the collapse of the Soviet Union and the Berlin Wall that migration, etc., global migration became a big issue. Didn't last too long. 9/11 took care of that, and now this is taken care of that completely. But you see, on the other point, what is the driver of the modern economy? The driver of the modern economy, and Arun is absolutely right in that, is consumption. See, what was India's problem last year? Last year there was no COVID. The Indian economy was tanking last year because you and I were consuming less. We were buying lesser things. The rural consumption went down for the first time after 1947 in the years 2016 to 19 after. So it is consumption that runs for an economy. And what is happening in Europe, what is happening in the US, if you see the early news coming in from China, the Economist this week has a great piece on China. And it tells us the battle begins now. Look at China. China has opened up. China opened up almost everything in February. Shops are open, factories are open, public transport is open, and consumption is down by 40%. Nobody is going to restaurants, people are not traveling, people are not buying things, and because of that, the factories work at half potential, which means that factories will fire half the number of people. It is really consumption that is going to be the problem. What is going to happen in India now? What is the real danger that we have? Almost everybody now has moved from conspicuous, from large scale consumption to just subsistence consumption. We are all buying groceries and food. I think one of the most foolish things that we did was to make this artificial distinction between essential and non-essential. You see, the moment you start deciding what is essential for me, you end up becoming either, you end up making either all mistakes or becoming a dictator. Because what is essential? I mean, is rice essential for you? It is not. Is bandwidth essential? It is so essential. So do I need to change my router today? If my router doesn't work, I have to change it today. Yeah. I have been working without a headphone, and it is very difficult for my needs to be the pedal needs to be changed. It's very essential. But what you have decided is that some food grains are essential, and that is why we have ended up in such a bad situation. What we ought to have done, and that's one point that I want to make, is that, why this essential non-essential difference? We used to make it in the 60s and 70s and laugh at the Nehruvian economics then. But we should have just said, all right, shops will be open, people will buy what they want to buy. Now, obviously, you and I will not go and buy fashion wear now. We will not go and buy, high-end wedding wear. But if your air conditioner is not working, you will go and replace it. If your refrigerator doesn't work, you will go and buy a new one. So we made that mistake. So what the point I'm making on consumption is that it is always wrong to make consumption decisions for someone else. There was this lovely piece which said that one person at a shop said that, look, I cannot survive without custard powder. That is what I eat. Please supply that to me. I mean, it is more important than bread. So anyway, so you see, what would have happened is that if we had not made this distinction, if we had allowed businesses to work without crowding, you see, what was important? Why do we have this lockdown? Because we don't want crowding. So whether it's a shop, whether it's a hotel, whether it's a mall, as long as we don't allow crowding, or a factory, as long as we don't allow crowding, there was no reason to just declare a curfew. That is what has caused problems with this lockdown. But to get back to the consumption issue, I am saying that till as long as consumption stays weak, production will stay weak. When production is weak, there will be high unemployment. When there is high unemployment, people have less money to spend. When they have less money, imagine if 800 million people in rural India, and this I am talking of last year, when we found that rural incomes had dropped by 40 rupees. Imagine 900 million people spending 40 rupees less every month. That is the kind of impact low consumption has on an economy. So that's why I repeat that our battle, our war will begin after this emergency is over.
One last point is, do you think government is loving COVID, or other authoritarian government, the government who wants control, the government who wants economic control, social control, governance control, is loving COVID and using it as a means to subjugate people and economy and everything?
The rulers are definitely very well off because there is a sense of power that they can, crack a whip and everybody runs inside. They can crack a whip and impose the most draconian laws that we have had so far, the Epidemic Diseases Act. You see all the arrests that are being made. So it is great for the ruler. And I'm not using the word government. I'm saying the ruler, be it the elected minister or the bureaucracy. For them, it's great. I mean, it's just wonderful that you don't have anything to worry about. It's very happy. There is no pickpocketing. There is no law and order problem. There are no traffic accidents. It is just wonderful for them. They have a great time telling people to run and go back home. So for the ruling class, any shutdown is good news because it allows complete total control. The ruler should be happy, the government should be worried. Why should the government be worried? The government has zero GST collections. The government has no money to pay its own officers. The Manipur government declared half pay for all its officers now. The government has no money to distribute even $7 billion that Raghuram Rajan says we need to feed the poor. Imagine a $3 trillion economy is in a miserable situation that it can't spend 65,000 crores a month to feed poor people. That is why government should be worried. That it is fine to have great control over your citizens, but it is a miserable government which will allow millions of people to starve to death.
So, in one line, what kind of India are we looking at post-COVID?
In terms of solutions, in terms of what we ought to be doing now, point A, we ought to be giving 5,000 rupees per month to all the 200 million people who have lost their jobs. 200 million into say $50 is $1 billion, right? Or $10 billion. $10 billion a month for the next 6 months. That is all that we need. What will that do? $25 of that is what people will use to feed themselves. Half the money. The rest of the money they will have to pay their rents, to pay their electricity bills, to buy medicine, and to keep a little bit of money ready when this lockdown lifts to be able to go and buy whatever they want to consume. So at one go, we are doing a welfare measure, which is that all the 200 million who have lost their jobs, we are giving them some money to feed themselves. We can't reach rations to everybody. All the problems with biometrics and OTP and corruption and whatever will creep in. If we transfer monies to everybody, they will go, their neighborhood shops are open, they will buy what they want and they will consume. They will have a little bit of money left. The moment you lift the lockdown, the second thing happens, which is everybody is clamoring for an economic stimulus. What they understand by a stimulus is some more money to the corporate sector. We gave 1,45,000 crores last year. God knows what happened with that. So money to the corporate sector is not the answer. What we do is by giving this money every month, you, having spent half the money on food and subsistence, will use the rest of the money to go out and buy a cycle, to go out and buy a shirt, to go out and buy a new pair of spectacles. That will provide the economic stimulus to the economy. So that is the first thing we need to do. The second that we need to do is to ensure that is to communicate that a lockdown is not a shutdown, that we are doing this lockdown only to prepare ourselves. This is a golden chance. This is a tremendous chance for the government to take money from every other place and build huge number of hospitals, have large number of beds, ICUs, ventilators, reach medicine to the poor. That is what we should have done, and we should now get ready to test 3,000 people instead of 300 per million. If we can do these three things, provide a welfare measure, give an economic stimulus, enable consumption after the, and to take public health to the next level, then we would see a better India. You see, very quickly, the 9/11 analogy. After 9/11, one sector did very well, and that one sector that did very well was security sector. All of us invested in security, including the government. The largest employment was for those who were standing outside various doors wearing uniforms with guns or without guns. It started millions of people in the CISF, industrial areas. So the security infrastructure grew handsomely. That is where all employment came. After COVID, the same should happen in the health sector. This woeful number that we have one doctor per 11,000 people, whereas we should be having a doctor per 1,000, has to be improved. So if we can now see a new India next year, where people are well behaved, the India that you are asking me for next year is an India where don't sit on the streets,
Well behaved, well hygienic, healthy.
where people maintain distance, don't with each other, push each other. They don't defecate in the open. They practice sneezing and coughing hygiene. They don't crowd at various places. And the big thing, and I think Dharavi is giving us a great chance to do finally what we should have done decades ago, which is to clean up and improve our slums.
Yeah.
We should be doing that. If we can do that now, then we will have a better India.
Wonderful, great. Thank you so much.